when I had my cardiac arrest, only then my mom and my sister were asked, which makes sense in a way, I guess, right? To also get themselves screened. But it would be better if we could do this way earlier and not have the cardiac arrest happen in the first place.
Yeah, I think that's exactly right. So I think the first thing that we all have to be aware of are the alarm symptoms. So um, in these hereditary diseases, it has been described that about in 30% of cases, the first symptom is the sudden cardiac death event itself. So in 70% of cases, there are these symptoms that happen before the sudden cardiac death event. And even in those 30%, usually if you really ask patients, was there anything, then they say, well,
Yeah.
I didn't have any symptoms. But if you really start asking the right questions, usually something already happened before, but the patient um, didn't recognize it as it may be being a symptom from an underlying cardiac disease that hadn't been discovered yet. And these symptoms are what we call alarm symptoms. And the first one is syncope, is sudden fainting. Patients don't feel it coming. There are no what we call prodroma, no symptoms before the syncope. It's just as if somebody switched the light off and the patient suddenly drops on the floor. They come round completely after a couple of seconds. It doesn't take minutes to come round, and it is as if nothing happened. This is what we call a sudden syncope, and it is always an alarm symptom. It should always lead to a cardiac investigation because it may still be something trivial, not important, not dangerous, but there may be a cardiac condition underlying it that can cause these lethal arrhythmias, that can cause this sudden drop in blood pressure, that can cause this, that will lead to this sudden syncope. So sudden syncope without any warning signs, without any prodromi, is always a red flag that should lead to a cardiac investigation. Mm-hmm. And the second one, of course, is referring to symptoms that may point towards imminent myocardial infarction. Is what we call angina pectoris. So it's this pressure on the chest, especially during exercise and in a later stage when it becomes worse, also during rest, like they are feeling that there's a weight pressing down on the chest. That is what we call angina pectoris, and this also warrants cardiac investigation to look whether the coronary arteries are still in check and there's no lack of oxygen during exercise or in a later stage when it becomes worse, also during rest. And it is also important to point out that angina pectoris can also occur in children. And this may be a sign of hypertrophic cardiomyopathy. So also in children, for GPs and physicians, it is important not to dismiss angina pectoris because it may lead to a diagnosis of a severe hypertrophy or thickened cardiac tissue even in children. So really important warning sign. Another one is heart failure. Of course, if patients have develop shortness of breath or develop edemas, peripheral edemas, the exercise tolerance goes down. These, of course, are signs that something may be wrong with the heart, and this also warrants, of course, a cardiac investigation. Another red flag and warning sign, of course, are symptomatic palpitations. So if the heart starts beating funny and it becomes a little bit woozy or a little bit black in front of the eyes, that means that probably there's an arrhythmia. There's a rhythm disturbance that may cause a drop in blood pressure, and also that is a symptom that really warrants investigation by a cardiac specialist. So the next red flag, of course, are the unexplained events. So where we have people that are good swimmers that suddenly got into trouble during swimming, almost drowning or having a near drowning incident. Patients with unexplained epilepsy. So these patients that had several epileptic insults, but where the neurologist was never able to prove epileptic activity on the EEG. This is also something that is a bit strange. And we have these syncopes or these fainting events that present as epilepsy, but that really are due to arrhythmias, malignant arrhythmias happening in the heart that cause blood pressure drop, and this blood pressure drop in the brain then causes the epileptic activity. Also, these traffic accidents that are strange, where the patient did not brake at all. So these are things that we always ask about, because these may also lead to underlying cardiac disease. And of course, the last one, which is always very important, is family history. So if there's already a patient in the family that suddenly died at a young age, so younger than 45 years of age, or had sudden collapses, or had alarm symptoms like the ones we've mentioned, of course, that is really, really important, because if the patient in front of you is a family member of that other person, this may lead to hereditary disease being there in the patient in front of you. So these alarm symptoms are super important. That's the first step to try and prevent sudden cardiac death.